Hello, everyone, and welcome back to the Empower Podcast. This is with Logan. Hi, Logan.
Hello,
And Logan, can you tell us a little bit about what you do into healthcare and where you're coming from?
I am a CNA STNA from Ohio.
Thank you for coming to us from Ohio, everybody. Again, Empower is a podcast run by healthcare professionals for healthcare professionals with goals such as establishing legislation in the state of Colorado and throughout the United States and hopefully the world, mandating employers to continue to provide employee wellness programs through a minimum of 8 wellness days for all healthcare professionals per quarter, a minimum deposit in an HSA account per quarter that is tax exempt at the federal, state, and local levels, and the establishment of an anti-retaliation department in all healthcare systems run by a third party. At Empower, we continue to believe in the power of community, diversity, and inclusivity to create positive change and improve society. Our podcast continues to aim at amplifying those voices that often go unheard, featuring interviews with individuals and organizations who are making a real difference in their community and beyond. Through thought-provoking conversations and inspiring stories, we strive to continue to raise awareness and transparency to promote action towards a more equitable and sustainable healthcare realm throughout the world. All right, everybody, this is the time of the show where I need you to go ahead and sit back no matter what, be yourself, and get ready to be empowered. All right, Logan, this is the part of the show where we start off with a big community thank you. If to those, anybody, it could be either in the healthcare realm, in your general community, or throughout the world that has truly made a real difference in your life or that you'd like to acknowledge.
I'd like to thank my favorite nurse, Pam, that I work with. She's an RN, and my mom, that's an LPN.
Wow. And your mom how long has your mom been a nurse?
I know she graduated somewhere right around 2008, 2009, and before that, she was a STNA/CNA.
Wow. And she's also,
So
oh, sorry, go ahead.
Yeah, she's been in healthcare for a long time, and she's pretty much my inspiration to get into healthcare.
Wow. And we've definitely even on staff worked together. Logan, countless hours. I want to throw that in, folks. That's how we do know Logan.
Oh, yeah. Good times.
Yes. Sometimes long
Very good
hours late
times.
at night, but we made do. We did our jobs. We got them done correctly. I think
And we had
patient care
fun
was
doing
cool.
it.
And that's, I think, one of the most important things to bring in is to be able to still play and have that ability to live while even you're providing for others, in whatever way that comes out.
Absolutely. Your coworkers is what makes work fun. Work go by fast. If you have a coworker that's not fun, it just makes it drag.
And that can happen from whatever upsets they have, or if they are upsets they bring into the workplace too. That's a real difference, I think, on the patient experience and
Oh,
from
absolutely.
coworker to coworker. Yeah. All right. Anyways, we allow our guests to identify in any way they would like to on the show, and be able to speak up from whatever identifying factors they would like, location and whatnot. If you can go ahead and check us out on Spotify, Apple Music. We have updated that. YouTube, Substack, and beyond. And where else here? We're on TikTok as well. We're going to be getting onto Pinterest and Reddit here soon. Those are coming soon, everybody. We also have a Ko-Fi, if you could check that out. We also have a Launchpad. I know all these great things that we had to be able to bring to you all listeners. All right. Thank you for the acknowledgments there, and for including those, Logan. Can we talk about the integrity of healthcare for you? And this could include what is happening in healthcare and beyond.
So in healthcare, as a CNA and a STNA,
Ooh, can we distinct there? Can we start there?
Semi underappreciated for all the work I put in.
And for those, CNA is Certified Nurse Assistant in Ohio. They call the title. They both exist, do they not?
Yes.
Okay, so there's still a distinction between them, but the duties that line up and the responsibilities, is there any distinction that you can see on your part?
No, it's basically the same thing. Some agencies here in Ohio do call their STNA CNAs, but most in-house facility staff are called STNAs.
Understood. Okay, because out in Colorado and any of the places I have gone, I've either heard technician in some way, shape, or form. They'll throw it into the title sometimes, or CNA is also the other one. Like I said, solely, I think I've only heard of STNA here in Ohio.
Yeah, I know up in I think it's either Oregon or Washington. They have CNA 1 and CNA 2.
Oh, I've heard of PCNA as well, or PC. Yeah,
Yeah,
okay. There's a distinction for that as well, huh? Wow.
yeah. There's a whole bunch of classes of CNAs and STNAs and everything.
I've heard of med techs too. There are some in areas where there are med techs as well, that are out there. But it seems that some of these titles and these professional names and classifications are coming and going in some way through language. I'm seeing. I mean,
Yeah,
there's distinctions as to duties and what was and what is. Yeah. Wow. What?
and the crazy part is like a med aid, like the STNA that passes meds or whatever.
Mm-hmm.
They make roughly the same amount as me, so there's really no point of getting that.
Mm-hmm. And then currently, I guess where you're at in Ohio, can you talk about kind of the facility you kind of work at or where you have in the past?
I've worked at quite a few facilities, and the current one I work at, I won't name for personal
But they're
reasons
in
and
Ohio.
all that. So in Ohio,
Are they in Northeast Ohio?
they are in Medina County.
Medina County. Got it.
Yes, it's a good facility. I like the residents. It's mostly the upper management that I'm not a fan of because, well, we're overworked. We have agency, but the agency we use, they either never show up or they drop the shift. It's just chaos.
Wow. And then you spoke to call offs. If we could look into that, how these call offs when they're coming in, do you say they're coming in when they're supposed to within the allotted time that's been set, or are some of them just last minute? And then it's what is it? Lack of planning on your part doesn't constitute an emergency on mine, kind of a thing. But then it becomes an emergency because it seems you're saying that this is still happening, and that it doesn't seem as if management is literally there's a lack of integrity in management by management. Does that make sense?
Yeah. So, like for example, last week
Mm-hmm.
I picked up it was only a 4-hour shift from 7 p.m. to 11 p.m. Right.
Mm-hmm.
I got in at 7, and I come in to find out that I am one of 2 aides for the whole building with 63 residents.
One of 2 for 63. And is that for a day shift? That's night shift? Is that the middle shift?
That's 7 p.m. to 11 p.m. So half a second.
7 to 11. Okay. And you came in finding that you were one of 2 for 60 residents.
Yeah, and we have a lockdown unit, and we couldn't. Me and the other aide could not stay in the lockdown unit because we had so many other people outside of the lockdown unit to do.
Mm-hmm.
So we had to have the nurse sit down in the lockdown unit. And it's all because agency didn't show up or they dropped the shift and our management did not repost the shift on the agency website or call anyone in.
And that didn't have anything to do with you literally coming in, clocking in, being ready and willing to work, correct? That was the lack of integrity on the staffing portion and being able to have communication, I guess, in whatever way that is, but beyond you, right?
Yeah.
Yeah.
The only thing I give props to is our scheduler. She did come in and help us because when we did get a hold of her, she posted the shifts, but no one was picking it up.
Wow. I know I just got an update. I'm not going to share the facility name either, but they are in Northeast Ohio. And they first sent me a copy of the schedule. And because I was a PRN nurse asked just for this, I think this isn't asking too much. And they were able to accommodate after some time that for the actual work schedule. And it's texted to me and I got it. If I can share it, it was from October 1st now until the 31st. The availability they was just saying was from 7 until midnight. And it's amazing you had mentioned that seemed like, don't get me wrong, there's the past guest had called it the witching hour, right before, right, shift change, and then right after, or as shift change is occurring. And that's when all the bold requests come out from patients are the ones that they didn't think about. And it's amazing. It's almost like there's a vibration of the whole facility. And everybody's like, oh yeah. And they all come to enlightenment, like.
Yeah. It's actually kind of interesting because they moved the nurses' shift from 7 to 7 to 6 to 6.
Okay, so check this out. For that, they were still abiding by a policy that was 2.5 nurses. So what they did from 7 to 11 is they have 3 nurses, and then they'll literally ask the other one to leave, unless for some reason, like you had stated, people didn't come in. So then these nurses will stay over because management isn't having this or looking at the integrity of communication or having someone even as a scheduler. Some places, I don't think they even have schedulers. That they're giving that duty up to upper management or somebody else. And it's like, that's not their job. Their job is to go around and look at the patient experience, be able to examine that, be able to be there for the staff, to be able to combat whatever it is that's there. And there's nothing wrong here with that, I think, is being able to redistribute those duties. Because I think it would put it put me at ease if I can share, Logan, be able to see that and know that even I don't have a stressed out boss, you know?
Yeah. Well, unfortunately, like in that scenario where we would have the 3 nurses from 7 to 11, if we were short staffed, we would have to send that nurse home because of corporate.
Yeah. I just heard corporate just went into the facility where I was at, and the new text I just got today from the DON said that we're allotted 3 nurses now at night and that I can work 12 hours. And I immediately, I don't think there's anything wrong with this. I immediately let other coworkers that I know that, because I don't think they know that. They're publishing it on paper in a folder where you have to drive and see it. It's not available. Some of these companies don't want to go digital. Totally get it. Then you know what? Invent a system or a possibility so people don't have to drive. Like when I worked with you originally, I lived 45 minutes away from the facility. It was one of my first jobs, and it was worth it to be able to get the experience versus having to pay money for gas. And I didn't look at it that way. And prices of gas were a little bit different back then.
Exactly.
And the cost of living was different too. But now I'm literally not as far away from this facility. So I know I'm like under 10 minutes to be able to work at it. And they were still playing hardball, I would call it, with 2.5. And as of now, and I started this job, last month, I think, they finally have availability now. It's like they're opening it back up. And I wonder if it's like a flower that opens up and closes and wilts and dies. And then that's it. And then they keep having other flowers that come out when opportunities come. And it's like, that shouldn't be that way. What about continuity of care? And continuity of care doesn't just stop with shift to shift, healthcare professional to healthcare professional. It's the overall experience, that transitional moment, right? And you have upsets during shift change. That happens. You have even people who pass during shift change, and then it's, did you like leave them alone? And it's like, nope, let's get clear and complete. Like, we know they were on hospice. Like, that happens. That can happen. It doesn't always happen, but like we said, I'm not calling it the witching hour, but it is. Something happens during that time. There literally is. And it's interesting to see what that looks like to even a patient who who's incontinent, and whatnot. And some people may think, well, shoot, like you didn't do X, Y, and Z, whoever they were. And it could even have been the nurse who said to the CNA, hey, I know you have to take care of X, Y. They're more important. Let me go do this. And then something else came up, and things can come up. And that's allowed to happen. And it's that overall, I think, getting clear and complete as to the overall movement from day shift to night shift, or night shift to mid shift, or mid shift to night shift, and all of that, and being able to look out for that overall integrity. Because honestly, I think that's one of the most vulnerable times. Wow.
Another topic I'd like to talk about is COVID.
Before
COVID, being a nurse, being a STNA, being a CNA was a completely different story. We worked for less. Like, I was probably making about 13, 15 back then. But I was happy to go to work because I was helping my residents. I had good coworkers, and I didn't even know what agency was back then.
Is this when we met?
Yeah.
Okay, I was making like 20.
Yeah, exactly. and after COVID, it just went all downhill.
That's
nothing.
People
started looking at healthcare as just a paycheck, not caring, not having fun with their residents. Don't care if they smile or not, just there to work and collect a paycheck.
Assessments, blood pressure, cuffs, and that's it.
Yep. I mean, don't get me wrong. There's still some people that go out there and try to make their residents happy, try to do the best they can do. But most of the time, they're just there to collect a paycheck and say, oh, yeah, I worked. It's very disappointing.
Or they're rushed. It's the other thing too.
Rushed.
Or they're rushed, and that's what people do different things when they rush, I think. And the management of the rush in whatever way it comes out too. And it's the people, even, I don't know if you ever had these people at work, and I feel you would be one of them, they could step back and literally just be. Just
chill. Like, talk to your residents, talk to your coworkers.
Yeah, and promote that and find ways to do that. And if things came up, they came up and they made it happen.
Yeah, I
So,
guess you could say there's no more customer service in healthcare.
ooh, that's a declaration. Yes, there's a definite lack of integrity with it, and being able to uphold the ability to know that it can happen and occur, because it occurs. It's occurred. It's
Absolutely.
happened. Like cat's not out of the bag for too long. It's been out quite a while. But yeah,
Yeah, I have one specific resident. Every time I come in, she is overjoyed that I'm there because I'm the only one that actually sits and talks to her. And it just makes me sad because back in the day, before COVID, that was never an issue.
same resident.
Yep. Every day I go into work. Even on third shift, you can still have a relationship with your residents.
I agree. I can speak. I'm not going to speak to it. I'm in full agreement with that. I've seen the possibility, and even what you can generate through. And Linda had said this. I've looked at the analytics, and I have to say my personal declaration. I don't think that one has enough listens. She has so much wisdom in that podcast. Not that anybody's does not. Everybody has their own fingerprint. Everybody they have a great
Mm-hmm.
unique fingerprint. But with hers, she speaks into listening and how much healing can happen in listening and just
Absolutely.
being able to be. Yeah, I think here I brought this up with me, Logan, was when you've had to be a sitter. Have you ever had to be a sitter in healthcare?
Yeah, I've had to do some one-on-ones.
One-on-one distinctions, same thing. I see them, and I guess for me, have you seen growth in the overall? Because not everybody who I think is a sitter is really a sitter because they're going to commit harm to themselves or whatnot. They may go to extreme lengths so that they have this opportunity in today's world. I think it is something that has to be a couple of check marks on an assessment tool to be able to have a sitter, or there has to be the ability in the budget to have a sitter. And it's like, I think, not to say that people should not have time to themselves to collect their thoughts when they're a patient or when they're going to the clinic or they're thinking about searching for stuff online and all of that. It's nice to
Yeah,
have another person, I think, to be able to listen, whether it's someone within your own social structure or someone who's not. And I think healthcare offers that other person outside of your social structure that you trust, and if you don't, you look to build rapport, and it's with STNA, CNA, FGHIJ, RN, any of them,
mm-hmm. Yeah. Every single resident deserves to have a support structure. Because you think they want to be in a nursing home? No, they're depressed being in a nursing home, especially when no one talks to them, especially when they don't have family that comes to visit. You're basically their family.
And they embrace you regardless if you want to or not. They'll look for things. I know. I just had a patient that every time I go in, she knows me. And now,
Absolutely.
and I've even known her for just a month, and it's, oh, you're still handsome. And it's not that everybody that walks in that freaking room is handsome, and it's not to put me into a different headspace too of like a whole, okay, well, ego absorbing. It's more of a, you know what, she may say that, but she probably may have said that to her husband or to her son or to
Yeah,
her nephew, and that's just her being able to relive and have that moment. And if that's what I'm up against, I'm please put me up against that. That
yeah. You
is
have no
that
idea
is
how many times I've
some.
been told, "Oh, you're just like my grandson."
Mhm. Yeah. And it makes a difference. I
It
think,
really does.
not that I'm looking for that. It's not, and it's beyond a piece of candy, which it seems is, well, I think you'd mentioned that. Oh yeah. Do we want to can you mention that on the show too? Uh,
Oh yeah, I will.
oh yeah. Oh, go ahead. We can declare it. Let's do it.
All right, so
What's
here in
happening at
Ohio,
your, yeah, what's happening at your,
candy
yeah.
is expensive.
Yeah. Oh, getting spooky to everybody.
Yeah, so in Ohio, a small bag of candy can be anywhere from like $13 to $16.
Wow. Is that like the pound bag? I think it's
It's probably about a half pound to a pound. Like it's
okay.
ridiculous.
Wow.
Inflation is really kicking us in the balls.
Yeah. Well, I mean, and you had mentioned prior in our talk, and I sometimes share if people do want to, whatever it is we talk about prior, if you want to prior talk. But yeah, to your work and the
Oh yeah,
and candy. Do you want to share that?
yeah. So my work's doing a trick or treat for the residents in the community, which is nice. But they are wanting us to donate candy for the trick or treat, which I would have no problem doing if candy wasn't so expensive.
Right. Wow. Have they asked for any of that around any other holiday in the past, or
No, but this might blow your mind.
what's that?
So it was earlier this year. So my work doesn't have the best reviews,
Mm-hmm.
and they gave us a incentive to go on Google and give them a 5-star review.
Really?
Yes. They said if we give them a 5-star review, we get entered into a drawing to win something, but they never told us what.
Did the what like disappear?
I don't think so. I think someone won it, but I did not hear what it was. But the
Management
fact that they
management
had
probably
to
won it and gave it
incentivize
back.
us to give them a 5-star review on Google was kind of like, what the hell?
Oh my gosh, my jaw is open.
Yeah, because if you look at my work's Google review,
Uh-huh.
most of the 5-star reviews are workers that work there, and someone actually points that out in the reviews. It's hilarious.
Oh my goodness.
Yeah,
That's one of the things that's happening in healthcare right now.
exactly.
Oh my goodness. Oh,
Bombshell mic dropped.
nothing wrong here. This is what needs to be able to be out there is to give me some truth. And
Exactly.
that's some real truth as to see that. And you know that if I mean I know depending on what people want to look at as statistics, but like we have Medicare.gov that has reviews and whatnot, but to see that is wow. I think the term is surreptitious is the term. I'm gonna go ahead and Google myself real quick, everybody. You heard some little keystrokes there. Yeah, surreptitious, kept secret, especially because it would not be approved of. Something done surreptitiously. Yeah. Huh. That's wow. Did they say what the cash dollar amount was?
No, they did not.
Interesting. I wanted to share this. There's a healthcare facility out in Colorado, and their referral program. There's a distinction that they've made now, and it's that you have to be a full time employee to receive the referral, and the referral is $1,000 given over 12 months. That's $83.33 a month. Everybody, I'll save you the time. And it's interesting to see that distinction now because I am PRN and I do know other healthcare professionals that are looking for employment, and that's what I'm up against. If I would give a referral, I have to literally be full time to be able to do that. Now, the demand for healthcare and the demand for healthcare professionals in general, it's amazing to see that it's almost like there's these walls that exist and it's the whole setup for success or not. And that was one thing that Susan in our last interview too for episode 34 had shared was as being set up for success. And I've heard it before, and it's a reoccurring theme I'm seeing within healthcare is, do you feel set up for success at the beginning of your shift? Do you feel being able to set up others for success at the end of yours?
No.
Yeah. And that makes a real difference because I think that sets patients up for success if that does come out in a way that it can, and it does set it heals a lot of, and I'm going to call them now the wounds of healthcare. Why not? If we have wounds within healthcare and we have wound nurses that come and go from facility to facility or for certain periods of time throughout the year due to statistics, why not? These are the wounds of healthcare, in my opinion, and to be able to look at them, acknowledge them, see them. And the thing about wounds is, they don't heal right away. They do take time and they do take maintenance and they do take reassessment as well. I know as a practitioner and at least even having CNAs and STNAs that I've worked with to be able to be there and be like, hey, like so-and-so's dressing like dropped off. And I'm like, okay, thanks. Like I did not know that. I've been passing meds on these last, 30 some patients, so interesting to see that. Oh, wow. What else do you think is happening in healthcare? Is there anything else you'd like to share at this time?
A lot of burnout,
Mm.
a lot of overworked, just not a lot of appreciation for home staff.
Mm-hmm.
It's
the distinction of agency versus, how has that been for you? The integrity of agency versus staff at your facility. Has there been a discrimination? I guess that's the way I see it. You don't have to use that term if you don't want. That's just the way I see it. It's a distinction for sure, and I feel like it's to the borderline now. where you even have like the agency that gets the harder assignment, or that they don't like, that's just the way that distributed it out. Or if somebody is a traveler, I've seen in hospitals, they're the ones that are taking on the tougher assignments, or they're being given that because they're a traveler making more money. What does that look like? Yeah.
So honestly, working with agency, there's good ones, but there's also bad ones. There's ones that are there just to simply get a paycheck.
Very similar to staff almost.
Sorry.
Almost.
And so what I usually do with agency, because if they get a hard assignment, they have no problem walking out, which is ridiculous. So I'm going to recall a night I worked probably about a month and a half ago. We usually keep 5 on night shift. 1 on one hall and 2 on the dementia unit, the lockdown, and then 1 on the assisted living and 1 on the therapy hall.
Okay.
And we had a call off. Well, we didn't have a call off. We had an agency no call, no show. And I work on the assisted living hall. So what I did was I moved the agency aide to the lockdown unit, so there would be 2 back there. And I took the harder assignment of working 2 halls, just so they wouldn't walk out. Because with agency, it's scary to think they feel like they can just walk out, and then we're screwed the whole night, because we would have been left with 3 aides for the whole building.
And that one you said was 60, right? Or was it 50? I'm sorry.
At the time, I think we had 64.
Census was 64. Yeah, for those who don't know, if you're ever having anybody go into a facility too, ask what census is and see what their distribution is for healthcare professionals. That's a conversation any common citizen could have, right? Even before even having some family member go there. They could go in and do a windshield study, I believe is what it was called back in school, where the nurse goes in and sees what's really happening first, and then goes from there, or the healthcare professional does. And you could be having Joe Schmo, you could mock it. There's nothing wrong with mocking a situation to see what, and do your own personal assessment. I don't think there's anything wrong with that,
Oh, absolutely. And do your research.
Do your own research for sure. Wow. Well, I think, is there another empowering pieces of advice that you would offer? And this could also include your quotes for the overall listeners that kept you with your overall passion that you do have, Logan, today, into wanting to share and give back.
If you want to get into healthcare, don't do it for the money. We get it, money's important, especially nowadays. But your main role is to keep the residents happy and take care of them, not just collect a paycheck.
Wow. Look beyond what your debts are. That could be a debt of just thank you for sharing that. Before I go anywhere, thank you for sharing that. That is, and it's that distinction of knowing that and seeing that. And I guess what I've got from that is, if I can share, is the people who are there for that, and it may be like a CNA that may have to choose between food and diapers, and they're there for that, and that's their mindset. Whatever it is, it's love, I think, that's coming from it. But what comes out of that, and what may be a projection from that individual and their situation, has an influence too. And it could, see what I'm saying? Like, it could be the distinction of they're there for money, but what is the money really being used for that maybe really means that to them? And there's a distinction too. If someone is literally there just for that, and they haven't looked to recreate and disappear that overall relationship, which is an upset, it sounds like, potentially, and seeing what they could really get from that, and what they could give after that. Not everything that they're giving is of monetary value.
Exactly. When I first started as a STNA, I was making $9.25 an hour, and I was the happiest person at my job. And right now, it's the most I've ever made as a CNA or STNA. But like I said, that shouldn't be all that matters.
Right. And somehow they can print it faster than we can make it. I'm still boggled by that one. Yeah.
And they'll be the first to cut your paycheck. Because at my work, if you are late or you have a call off, you lose like every bonus for that pay period. Even if you picked up a shift and you got a bonus, you lose it.
Is that really an incentive?
Yeah.
That sounds like a whole other podcast.
I know, but if you pick up a shift at my work, they give you $10 extra an hour. Mm-hmm. But if you're late once or you call off once, you lose all of that.
Wow. It sounds more in favor of them than within the healthcare professional, huh?
Exactly. Like, I can understand that, but at the same time, it's like we do so much. Like, I believe CNAs and STNAs are the most underrated staff in the nursing home. So CNAs are pretty much the backbone of healthcare. We're so underappreciated. We do all of the heavy lifting, especially a male STNA. If we want to dive into that,
And a male healthcare professional. I've seen RT, PT, OT, all of them do it. Yeah, and I've seen ones reinforce proper mechanics too. That is a distinction there, to have education for that.
Oh, absolutely. I've been at STNA/CNA for probably going on about 6-7 years now, and my back is so messed up, and that's with proper mechanics.
Mm-hmm.
And a lot of places I've worked here in Ohio, a lot of the beds, they either don't go up high enough or they don't go up at all, which is crazy.
Or are they from like 1962?
Yeah, I've had
when
a facility
electricity
where
was
I've worked
invented.
at where they still had crank beds.
That's not when they were invented. Everybody who was born in 62, not trying to be mean. I'm saying that those beds are as old as that. They really are.
Yeah, it's crazy.
And they're unoiled, unmaintained. I've been in a room.
We know these places have money.
Yeah, I've been in a facility at 3 a.m. and you're pushing the up button, and it's literally like raising. I don't know. It's almost, forget The Exorcist. It's not that quick. It's literally even faster. It's even slower than that.
Yeah,
and then you're waking up half the hall.
You're like, for third shifters, when you're doing your morning get-ups, you want to get them done and over with quick. And you just can't, because those beds are god awful. So you just end up doing it where the bed sits.
Mm-hmm.
And it's not good on your back. Like, I actually developed scoliosis from this job.
Wow.
I have a 12% curvature in my back right now, and it hurts. But I still push through every day.
Mm-hmm. I know we've had past guests. I don't know state legislation in Ohio. I do kind of know it in Ohio. I believe it. They do have a medical program. Have you looked into any other alternative therapies in the medical realm?
Yes, I have. I've been through physical therapy. I am prescribed really strong muscle relaxers, and it doesn't seem to work. And especially now, because here's the next topic I was going to bring up. So at my job, I went PRN for a month because I needed a break from full-time. And they were still taking my health insurance out when I was PRN, so I wasn't getting a full paycheck. And then I went back to being full-time, and my health insurance was still coming out. So I was like, oh, so I must still have health insurance, because I was still paying it. So right. I went to the doctors, specifically the eye doctors, and it turns out I do not have health insurance because my work canceled it. But for some reason, the health insurance provider did not get the word that I went PRN, so they were still taking it out of my paycheck.
So you still got charged for it, but no benefits, right?
Exactly. Okay, hold on. I'm not reimbursed for it.
And you weren't reimbursed or compensated. Wow. Nope. I had somebody I spoke with yesterday. They just had they became a victim of debit card fraud, and when they did, they had shared that the overall situation, they had a dispute in for 45 plus days, and it said there was even like actual employees they were speaking with talked about a lack of integrity when it came to providing overall services to this person, because of, they're like, oh well, we a number of different things, and one of them was that there was a lack of integrity amongst the disputes department, which was supposed to be handling the dispute for like 30 to 40. I guess they originally said 15 days, then it became 30, then it became 45, and no one was talking. And it's amazing to see being set up for success. I'm just blown away that there's still a separation in medical coverage for eye and dental, and why those are all separate still. Like, I don't understand that. It seems like they're all very similar, and they're all in the same spacesuit plan, I would say, which is your body. But because we are still floating through the cosmos.
I could start a whole new podcast on health insurance alone.
Oh my gosh. Yeah. Yes, absolutely. That'd be a whole other podcast.
I'm not sure if you know this, but I actually took my license took my test to be a licensed health insurance and life insurance agent.
How'd it go? What happened?
Pretty good, actually. I passed my state test, so I am a
Congratulations.
legal health and life insurance agent. The only issue is the insurance company I was applying for dropped me because they were tired of waiting for me to take the test.
Yeah.
And my excuse at the time was my great grandfather passed away.
Yeah.
So they told me, don't bother. We're just going to move on. So that's how that went.
But you still have your overall test for it, no?
Yes.
You still have the certificate and whatnot. That's
I do.
unfortunate to hear about your grandfather, but and to see what that looks like. And you know what I want to acknowledge when it comes to that, and thank you for sharing that, Logan, is being set up for success if someone wants to look into transitioning from their career, even if it's to try something on, to see that, if someone is potentially burnout, I don't know what someone's wellness looks like. I don't see what their journey for that, like everyone's is different, I think. And being able to say, maybe I want to take a year off or under a year, because some places right now, I know for travelers, they're mandating that you have to have at least a year experience in a prior specialty after you have your 1 or 2 years as, doing it within med surg and before. So there's all these things and check marks that need to happen before. And then even after that is completed, then if you're in a certain specialty as a traveler, if you don't work it for a year prior, a lot of agencies aren't even looking at you.
Oh, that's another thing I'd like to talk about.
Yeah.
Going back to agency aides.
Mm-hmm.
If you're a new STNA or a new nurse, don't do agency.
Have you seen that?
First.
Have you seen this?
Huh?
Have you seen this in the field? Like you actually see like 1 year or freshly, and I have to say freshly, but like newer
yes.
that are agency right away. I know during COVID it was a thing. I had seen it because of what was happening, but I'm not. Wow.
Yeah, if you're new to healthcare, do not do agency first. At least get your foot in the door, get your feet wet. Do in-home first. Yeah, agency sometimes pays more, but like I said, it shouldn't be about the paycheck. You need to better yourself and get yourself acclimated to healthcare before you can do agency.
Yep.
That's how I feel about that.
And that's, I feel, and that's, so whoever's, thank you for sharing that, the risk, not only for yourself and whatever it is you want to, whatever certificate or authorization that you have to be able to provide a service, but also that for the patient and their overall experience too, and seeing that. We talk about setting people up for success. Well, there's also that is being able to see on the team coming into that someone that you maybe don't know, you've never worked with before. And I've seen the moments where someone comes into their new agency too, and I can't work with that person. I can't. They come straight to me. I can't. Like, I just can't. And it's like, okay. And the resident, I can't do that. I can't work with them. And then some of them are literal Karens that are out there, whoever they may be, whether they are named Karen or not. And it's interesting to see how that comes out. And I'm not here to be mean with the name Karen. It is a literal person that it seems that you cannot please. And it comes down to, I think Linda had shared this on hers, and like I said, I'm obsessed with Linda and her podcast. But in it, she had shared this too, that her mom was originally a nurse, graduated in 1924. She asked her mom that. She said, "Mom, how did you deal with the grumps? How did you deal with the ones that really you couldn't really please, and whatever it is you did, it was constant for them?" And she said, "Oh, they're not that way. They're just scared." She said, "And some of them, they're scared to death. They really are." And they just, and whatever comes out of it, that's what we're really up against when we look at it. But that's not the initial, I don't think. When I heard that, that made so much in my career make sense.
Yeah. You cannot be a care in healthcare.
Yeah. Oh no. Or even if you have one, that is true. No care is working within, at least. And if you do, maybe look at it. Ask your coworkers, ask your cohorts, how do I come off? Do I come off as abrasive? Do I come off as hostile? And
Exactly.
what does that look like? Because if that's really what you're up against, it could just be a conversation.
Yeah. And if you can't work or you don't want to work a specific hall, like a lockdown unit, you should not work in a nursing home.
Yeah, because
in order to work in a nursing home, you need to learn every single floor in that building. You need, especially if you're a new nurse or a new aide, you need to know every floor in that building.
not only for yourself, but also take a stand with your employers. I know in Colorado, the PRN job there as well, they did. They gave time. The one who had the referral bonus, the way that it was, I want to acknowledge this for them. They did give up to like 2 or 3 days. If not, if you needed
Absolutely.
their new DON, I want to acknowledge her and what it is she's creating and generating too, because she's setting a standard that I think is something that I look forward to, and it's something that I have been looking forward to and seeing what that would look like and how someone would be able to do it. And she's doing it. She just had state too come in. They just audited. They just came in, looked at everything. They even stayed an extra day over, believe it or not, past
Oh, we
their
don't want
period.
to talk about state in my job.
Oh well.
It's bad.
Mm-hmm. It's amazing too. I'd be curious if, and this is a theory I think I said in a past one. It's all theory though. That agency and state, excuse me, whatever the agency is, the auditing agency or state will be coming in prior to January, and they'll be in there right before, because we are. I mean, we're up against. I mean, when COVID was literally declared, it was what, like around December, January ish. I think it really, the knob started to turn up in severity, and that was something totally different. But yeah, and it's amazing to see what that looks like and the way that they're operating at this current juncture too. But
Yeah, so I have another jaw dropper for you.
oh, go right ahead, share.
So at this facility I worked at, the administration was blaming the in-house aides for the increase of UTIs. So they made all the third shifts stay over and perform pericare on a dummy, which involved catheter care and pericare. And they set up a fake room that had stuff wrong with it, and we had to point out all the differences in the room, which I can respect. We
Absolutely.
should do that yearly, yeah. I think.
I did that in school. In
exactly.
Clinic, in the
and what we didn't know was going to happen is that the DON came in and told the third shift and the first shift nurse that we had a code blue and that they needed to grab the crash cart and report to the room where the dummy was. So our crash cart is made out of PVC pipe.
I've seen these. Yeah. Oh, is it a low cart? Is it? There's some that are
Yep.
raised up to your waist level. This one's a low cart. All right. Yeah. What's on
Yep.
it?
And it just has a cover on it. So the nurse on third shift rolls it down to the room, lifts off the cover, and the DON's mouth dropped. Because all that was on it was a suction machine with no tubing and a CPR board, and that was it.
Wow.
Yeah. The DON's face was so white. I'm like, how do you've been here for like 6 months and you don't know anything about the crash cart being like that? I just feel like administration doesn't pay enough attention anymore.
I know during right before COVID had been declared, when I was on assignment in Colorado, and that's where I was through a good portion of COVID, the crash cart was something we had to check nightly. Even though I was still a traveler, I learned how to do it. Because you know what? I am glad I did, because I got to see what I could hold others accountable to. Especially since
and the funny part is no one signed off on the crash cart for months. Except for one nurse. And I was like, how can you even sign off on that?
You did. You declared to them how they could. And do you remember what they had said, or did they just omit and not say anything?
They omitted and said nothing. And then the very next day, the crash cart was fully stocked. So at least they corrected it, but it should have been corrected way before that.
I think your outreach made a difference, Logan. I want to acknowledge it as a possibility. Your stand that you took, even though it was a simple phrase, and I don't think you meant it in like malevolently towards them. You literally just was trying to raise transparency and awareness as to if you were to need to help out.
Exactly. And another thing is, at my work, CNAs and STNAs are to be CPR certified, right?
Mm-hmm.
So my CPR expired last November, and my work was going to hold CPR classes for aides and nurses. Well, those classes never happened. So I can't help either way legally.
Did you revisit with them or see what that looked like? Or they didn't on their end get connected to it, sounds like, which would be proactive.
My DON said she was going to get certified do the classes herself. Mm-hmm. And apparently, from what I hear, she did, but I haven't heard anything since.
I believe she's the one that signs her name on the cards, too.
Yeah, probably.
Yeah, and I get that.
But it sucks because my favorite nurse I work on night shift with, Pam, I mentioned her
Oh yeah, that was your thank you.
at the
Yes,
beginning.
I got it.
I told her, I was like, because she's not CPR certified either, because she was trying to get it through our work and they're not doing it for us. And she's an RN. You should be CPR certified as an RN.
Yeah,
but she
I'm
can't
mandated
get it because my work's not providing it.
I'm mandated to get my BLS, even to travel. That's checked. I just did mine this past night. I've even seen people in chat rooms on Facebook. So I do get on there and connect with people, believe it or not. Even on Instagram, I am active beyond the podcast. But to see what classes and how much they were offered, and one of them was like literally a travel job or travel nurse chat, just to see, because I'm watching contracts. I'm seeing what they're like. I want to still watch and monitor. I'm looking to transition, and I have been to working bedside, working remote, and I've invented this as a possibility, but do it in the meantime. But wow, that's interesting. Well, I would love to check back up too on this overall use of being able to have staff provide that. I'm shocked already just by hearing an employer that's willing to do that, because it hasn't happened in a while, at least unless you're like a bigger hospital. But to hear that at a facility, that's something totally different to recreate. And that I see hope in that. It's just what that looks like. And there's knowledge and then there's action in this world. And it sounds like you have the knowledge of it and they've provided the knowledge to you, but the action seems to be the distinction area.
Yeah, the knowledge is extinct.
Yeah. Oh my goodness.
Yeah. Healthcare is crazy nowadays.
What will they redo it? Have you asked them? I'm curious.
Probably not, because there's been times where, so we use styrofoam cups, right?
Mm-hmm.
So on third shift, we change the water cups nightly. There's times where we've had no cups whatsoever, and I'd actually go out and buy some with my own money, and I would hand them the receipt, and I would not get reimbursed for it. And I'd spend like $40 on a big box of styrofoam cups.
And they were already using styrofoam cups. I'm already weirded out by styrofoam.
Yeah, same.
That's a whole conversation. But yeah,
my facility is a smoking facility, so we allow the residents to smoke.
Mm-hmm.
And there's times where I've went and bought residents a pack of cigarettes so they can smoke, and I was not reimbursed for that either.
Wow.
I actually had my scheduler give me money out of her own pocket to reimburse me, and I declined it because she shouldn't have to do that.
I agree. Especially if that's for the patient's overall quality of life. If they're A&O times 4 and they are able to make their own decisions and they are their own power of attorney, I don't see any reason why. I'm not here to promote them to do it, but if they would like to live their life and that's what they would like to live their life like, I'll provide my education and go on my way. And when I have the time to provide it, and there's nothing wrong with doing that and moving forward. I know in Colorado, they also have, it is a smoking facility as well. And they do follow their policies. Whatever the residents would like to. Some go away from the facility, and some violate and do whatever it is they would like to. And that's just what that looks like for them. But they do offer that as an opportunity. I've never purchased. It's interesting to see the outreach you've made for that person, if that really made a difference for them. And it's to see what it looks like when your employer looks at that. But regardless of that, even with the cups, it's just literal overall quality of life to be able to have resources. I know there's a resident currently where I'm at. She saves, and now I think I'm learning why she saves her cups.
Yeah. And another thing that my work does, so like I said, we pass ice water every night on third shift.
Mm-hmm.
They started locking the kitchen at nighttime, or the
kitchen's locked. Kitchen's locked where I'm at too. There used to be a key that was available for staff.
Yep, and they took it.
Yeah.
So at night shift, when I come in, if second shift doesn't get ice and put it in the ice chest, I don't have ice all night.
There's only one ice machine.
There's only one ice machine.
Okay, where I've worked at, there's been like one that's open that you put a lock on that you follow at least that's per, I believe, Ohio law. They have to at least have a lock on it. And
mine does not.
Wow.
But it's locked up in the kitchen, so I guess that makes up for it in a sense. But our ice chests are not locked.
Are not locked, okay.
No. And honestly, I was sanitized.
Yeah, I know the facility where I'm at now, I was back at originally where we worked at. And do you remember there was a person who worked maintenance, and he came in one night and there was an actual wheelchair machine? Did you ever see that? The cleaning one?
Yeah.
Were you there for that?
Yeah, that thing's cool though. When it
Yeah.
does work.
Oh yeah. Oh no. Absolutely. I just remember him first of all having a job, or they having a job, and that being something that they were doing on their off time, or to be able to, I guess help out with the facility and see that. But I don't see a whole lot of maintenance people there seem to come and go to. Lawn care at facilities is going to its own area. Even prep, for the fall or even any season, and to see what
Yeah.
that looks like too. I know where I was at in Colorado, it was in Morrison. The overall wound care nurse was caring for the flowers outside. She was going and watering the flowers in between her time, and if that gave her peace in between what it is she was up against, well, darn it, I don't see an issue with that.
Mm-hmm.
And to see if that's something she wanted a way to give back, that was her buying cups. That was her, and to see what that looks like and the support for it, because I know right now they don't have the wound care nurse. Found that out.
Yeah.
She might be out of their too expensive for their pocket. I don't know what that looks like, or they look like. Anybody can be a healthcare professional or a nurse or any of that. It doesn't just have to be women. I'm saying that has been some of what I've run into. I'm in a female dominated profession. Totally get it. Nothing wrong here.
So you want to know something that's ridiculous but kind of funny?
Oh, absolutely.
So my work, when we got our new DON, she implemented a employee of the month voting every month during our monthly meetings.
Okay.
So I've never won, which I don't really care about. All you get is a parking space and a card that says thank you. So it's not that much of incentive, if that makes sense. But so they post your picture on a billboard, not a billboard, but like a bulletin board in the front hallway with everyone that voted for you. And it's so rigged because so the maintenance guy won employee of the month last month, right?
Right.
Explain to me how a bedbound dementia patient would vote for him.
I'm not for sure on that. They literally say the resident. Wow.
Ballots that have the same handwriting from multiple dementia and Alzheimer's patients that are bedbound. That would have nothing to do with the maintenance guy.
Wow. I know. If I can share, there is lack of integrity to talk about with healthcare, and another one that I've gotten is the DON where I'm at right now. We worked through an agreement to be able to send me the schedule, so I know availability, and if I can work it, I work it. If I can, I can't. And I'll let her know. But she had just made outreach to me and sent me a picture saying that now they can have 3 nurses, right? Or that was the second text message. The other one was a picture. The other one was a picture. But in it, you can literally see resident names in the picture. Like total HIPAA violation. Yeah, 120%.
Wow.
I was like, and we're not talking one. We're talking like probably 4 to 7 resident names that you can see.
Wow.
And I get things happen. I get things are there and what's convenient, but that's rushed. We talked about rush and what the rush looks like. That's what I think is rushed. And I understand too, and I've seen it throughout the overall integrity of healthcare. Even when I was a transporter at within Akron, Ohio, I'm not going to say at what facility, but when I was there's doctors who were taking pictures of patients' charts and whatnot. HIPAA violations happen quite a bit. They're more common than most people realize, and it's that integrity to restore it. And I think for me, there's ways to do it, and I've done it where you let the patient know, like, you see this? Yeah, your name's on it, so I'll throw it away if that's okay. And they're like, oh, okay, thanks, appreciate that. Like there's ways to do that, but to literally see it that way, like how am I supposed to send that to my significant other so they can see that and have the actual resident names be up there? And that, I mean, okay, it's just what I got from that. Bear with me. But all right. I didn't know if there's any other empowering pieces of advice or quotes that you'd like to offer everyone right before our farewell. Until next time, everyone.
Residents are objects. They are people too. So treat them like people with respect. Respect is earned. Respect is given. It makes a easy and fun job.
Love it. Logan, thank you for coming to us again from Ohio and being here, everybody. Again, this is the Empower Podcast with Logan. Signing off.
Peace out, y'all.
Bye for now.